Myself, Dr. Milind, Barhate, psychiatrist, practicing in Mumbai since last 10 years. Mental illness is the most common illness in the world. And stress is one of the most common factor for causing most of the psychiatric illnesses. People believe that stress is not a psychiatric problem and it is a part of life. That's why most of the persons, they are not coming for the treatment. Some misbeliefs about stress are there. Stress affects everywhere. It affects your mind, your body from head to toes. It affects everywhere. When it affects your mind, it causes migraine, headache, vomiting, nausea, paralytic attack, heart diseases, blood pressure, diabetes, acidity problems, stomach problems, breathlessness, tremulousness, muscle cramps, sexual dysfunction, and lot of illnesses, constipation, diarrhea, anxiety problems. It affects every part of the body. Not only body, it affects your mind, it affects your emotions. When the emotion affects, person becomes irritable. He feels sadness of mood. Then gradually other faculties of the mind, they get affected and person goes in either depression or other anxiety, sleep problems, psychosis, mood disorders or addictions. People believe that stress is not a problem, and when it becomes a big problem, they came for a treatment with a disease like depression, anxiety, mood disorder, psychosis or with a suicide attempt. That time treatment becomes difficult and patient has to take a treatment for a longer period. There are a lot of factors causing stress. Most of the people, they blame others for their own problems like inflation, job problems. Most of the times he himself is responsible, like his character defect, irresponsible behavior, suspiciousness, not taking the responsibility of family or child or at workplace. Like this, unmanageability, procrastination, there are a lot of character defects that lead to the problem in either at home or workplace or in society, that lead to stress. So when the management come about the stress, most of the people, general people, they either go for changing their lifestyle, starting the exercises, pranayama, moving around or reading some books or listening the music or going outside. But it relieves your stress, but only for a couple of days or couple of weeks. Again after a couple of days or weeks, the stress it becomes as it is, because the reason for the stress is your character defects. Unless and until you are not going to change yourself, the problem is not going to come down. So when the management of stress comes, initially and most important, the character defects that lead to the stress, it has to be managed, and it needs a tough and long therapy, behavior therapy, counseling, and if the problem arises, psychiatric problems, then you may need a psychiatric help. For more details and further contacts, you can contact me on Lybrate.com. Thank you.